From the Cronkite studios in downtown Phoenix, this is Cronkite News.
Good evening and welcome to this special edition of Cronkite News on Arizona PBS. I'm Alexis Leal. Cronkite News has a special team of reporters on the health beat. Tonight, a look at some of their top stories, from battling the flu to funding the fight against Alzheimer's disease.
The only thing that's predictable about flu season is that it's unpredictable. As Cami Clark reports, this year, scientists made changes to the vaccine, trying to figure out which strains they need to fight. And they're hoping more people get the shot.
In the first 3 weeks of flu season, nearly 100 cases of flu were confirmed by the Arizona Department of Health Services. Last year was the deadliest for flu cases nationally, according to the CDC, and fewer people got the flu vaccine last year. Pharmacy manager Brandon Luke says this year's vaccine is a little different.
Every year the flu changes, and we try to stay ahead of it. We adjust the vaccine accordingly to where we think it's most likely to be going. So this year we've updated it for the 2018 flu season so that we can have the right defense against the right bug.
And those modifications help increase the effectiveness of the flu shot, according to Chief Nurse Practitioner Tammy Ostrowski.
We predict what is coming, and we try to predict what vaccines are going to be the most effective. The flu vaccine does adjust and change every single year, so matching that to what the prediction is what's best.
During last year's flu season, Arizona was ranked lower than the national percentage of flu vaccination coverage among adults at about 35%, according to the Centers of Disease Control and Prevention.
So every year we work really hard to get vaccine numbers up. And the reason that we do that is so that we have some additional immunity. So there are people who cannot get flu vaccines. Either they're immune compromised, they have an actual true allergy to the vaccine. So we want to protect all of the people that we can.
And costs shouldn't be a barrier to getting vaccinated.
Really, at this point, it's about education. Most everybody is covered if they'll just ask. It's not, we're trying to make cost not an issue. There's programs, there are a lot of different ways for people to get the flu shot.
Your best shot at preventing the flu is getting your flu shot, and it's also your best shot at staying out of the pharmacy. In Phoenix, Cami Clark, Cronkite News.
It takes about 2 weeks after the vaccination before it's fully effective. The CDC recommends that people get a flu vaccine by the end of October.
The director of the Mayo Sports Clinic here in Arizona traveled to the nation's capital to talk about keeping young athletes safer from concussions. Cronkite News Washington reporter Ian Solomon has the details.
Are you worried about your child being injured playing sports? If so, you join 87% of parents nationwide. But a new partnership between U.S. Youth Soccer, the Mayo Clinic, Injure Free, and the U.S. Center for Safe Sport is aiming to lessen those worries.
Say that our system is designed so that if an injury or a suspected injury occurs, the parents or guardians of that child will be connected with licensed regional medical professionals.
The system U.S. Youth Soccer CEO Chris Moore is referencing is the new Athlete Incident Management System, which is being implemented nationwide. AIM is not only meant to provide resources to coaches and parents, but also collect injury-related information, something that isn't being adequately done now.
Majority of concussions actually don't make it into those reporting processes that are there, which is another nice thing about this collaboration. Hopefully we can get a little more information on concussion, even through things that doesn't make it all the way to CDC information.
Concussions are the biggest source of worry for many parents. President and CEO of Injure Free and former college football player Charlie Wound says there isn't enough oversight to ensure the safety of athletes.
A game where I remember watching film and there was about 3 or 4 plays I could not remember after getting hit in the head, but certainly nobody else stepped in to pull me off the field.
But Wethy says there are many other health risks that need to be addressed, and AIM will deal with those too.
You know, hydration, when it's very hot, that's a concern too, and that's a part that we don't talk about so much necessarily in the media, but is a really concern, especially for those of us in Arizona where the heat-related illness is a significant concern.
The hope is that the AIM system will put an end to the lack of research and education of these injuries that put young athletes in danger.
Every day that we let this go further, there's another child that's being put at risk in somewhere.
In Washington, Ian Solomon, Cronkite News.
As the number of people diagnosed with Alzheimer's increases, there's concern over the lack of progress in research into prevention and treatment. Reporter Jimmy Jackson spoke with Arizona leaders in this research area to see what impact a lack of funding is having.
In recent years, Alzheimer's research funding from the federal government has increased to an all-time high, more than doubling between 2015 and 2018. But to prevent a disease that still has no survivors, it still may not be enough. According to James Fitzpatrick, the Director of Programs and Advocacy at the Alzheimer's Association, Alzheimer's disease is the least funded chronic disease in the United States. He says that lobbying Congress to continue to increase funding is critical.
Cancers and HIV and these other diseases in the top 5 in our country are still receiving way more than what we are, and it's not enough.
The National Institutes of Health is the federal research agency that allocates funding for diseases, and Alzheimer's now receives an estimated $1.9 billion, which is an increase of $1.2 billion over the last 4 years. Paul Coleman, a research professor at Arizona State's Biodesign Institute, says another issue is that the fight for grant money is very competitive.
In the recent past, the money has run out only when they get through the top 5 to 7% of the proposals. That means then that the other 93 to 95% of the work that people have proposed never gets funded, doesn't get done. So certainly this has been an impediment to progress.
Most research in recent years has focused on plaques and tangles, which are proteins that build inside and in between neurons in the brain in areas that affect memory. However, Coleman says this research is limited because it does not reveal enough about the causes of Alzheimer's that may begin earlier in the brain's development.
It's my opinion that the devotion of a number of people to looking at plaques and tangles has interfered with real progress in understanding what's going on with Alzheimer's disease.
Eric Ryman, the executive director of the Banner Alzheimer's Institute, says that he would like to see funding reach $3 billion, and with that, researchers will be able to continue current research while also exploring other areas.
We have the opportunity to take the more traditional findings, put them to the test in more powerful ways, and find out one way or the other, are they on the right track, or should we pursue other mechanisms? At the very same time, we need to be thinking about novel mechanisms and risk factors, new targets at which to aim treatments.
Ryman says that Arizona has an advantage because it is a major research hub for Alzheimer's. In Phoenix, Jimmy Jackson, Cronkite News.
In 3 decades, Alzheimer's is expected to cost $288 billion to the U.S., according to the Alzheimer's Association. If there's not significant progress on treatments or a cure, experts say the cost could bankrupt the country's healthcare system.
Surrounding yourself with others going through the same hardships as you are can really lift you up. Sammy Giebers visited a weekly Phoenix art class that brings together a group of people dealing with the same conditions.
Hey, Betty. What's on your mind today?
We have primary colors that you know very well about.
For Dora Hernandez.
So let's start with the yellow and we'll add some red.
It's getting paintbrushes in the hands of her students.
So funny to call them students because they're usually much older than I am. I've learned a lot from you, Anna Banana.
But she's not always the teacher.
What I've learned from Betty is you focus on something and you do it and do it and do it.
I just enjoy doing it.
From Rolly, I've learned attitude. Bill is really consistent. It's Vicky, very joyful, very good.
Focus for the class with art in mind isn't the painting, but the camaraderie.
You still love me?
And sometimes the focus,
and of course,
is on recalling a name.
I can't remember.
Betty.
Betty, she's extraordinary.
The class is for those dealing with dementia or brain injuries.
It helps when you share something you have in common with everybody else.
And just across the hall,
oh, there they go again,
is another type of support.
Laughing next door like they're having more fun than we are.
With coffee and donuts, the artist's loved ones share their own stories.
I think like it for the same reason they do. We're all caregivers of somebody who has Alzheimer's, so sharing the same experience because we're in the same boat is a good thing for us.
Always do your own thing.
And they do work on their own paintings. But you can't say they're on their own.
Rolly, he's over the top.
What'd you call me?
Over the top.
Stop your gambling.
And at the end of the class, what's on everyone's mind?
Good night, Irene.
It's whatever Rolly is singing. In Phoenix, Sammy Giebers, Cronkite News.
This class began as a partnership with Banner Alzheimer's Institute. The group meets weekly at the Phoenix Center for the Arts.
The fight against Alzheimer's disease is one that 5.7 million Americans are faced with. Reporter Jimmy Jackson looks at how people affected and advocates in Arizona join the Alzheimer's Association and its annual walk to spread awareness to find a cure.
She went to the grocery store and we got a call from a farmer who lived outside of town about 20 miles saying he had found my mother and she was not able to get home. So we knew right away something was going on.
Chuck Hill attended the walk in support of his mother, who was diagnosed with Alzheimer's in 2000. He says after being personally touched by this disease, this is a cause that he will support as much as he can. Hill, as well as others, carried a purple flower, which represented people who lost loved ones to the disease.
Well, everybody has a different reason why they walk, and the flower ceremony is a powerful way to demonstrate people's different reasons for being here.
Yellow flowers represented those who are caregivers for people with Alzheimer's. According to the Alzheimer's Association, compared with caregivers of people without dementia, twice as many caregivers of those with dementia indicate substantial emotional, financial, and physical difficulties.
She lived with my dad, and they lived in an independent living apartment for probably the first 8 years of the disease, but then the last few years we had to put her into a memory care unit because she began to wander and we couldn't keep up with her.
The goal is to raise $675,000, which will go towards care and support for the over 140,000 people over the age of 65 in Arizona with Alzheimer's.
We also do support groups, educations, things like that, and then in addition, a percent also goes to research. And there's some incredible research being done right here in Arizona.
In the absence of cures and treatments, Alzheimer's has a 100% mortality rate. Hill said early on his family exhausted themselves trying to correct his mother's memory, and his advice for others currently caring for a loved one with the disease is to not spend all their time fighting its progression.
You know, once we stopped fighting the progression of disease and just sort of learned to live with it, frankly, our home was much happier. And again, because we just sort of adapted as we went along.
The walk marks the beginning of Alzheimer's Awareness Month, which is the month of November. In Phoenix, Jimmy Jackson, Cronkite News.
The man who fell to the bottom of a 100-foot mine in western Arizona 2 weeks ago spoke about what happened for the first time Sunday. Cronkite News reporter Bryce Newberry has the survival story.
Tonight, the man who some are calling Arizona's Indiana Jones is recovering at Banner University Medical Center. He broke a leg and his ankle when he fell to the bottom of a mine shaft. After nearly 3 days in the dark with no food or water, he took desperate measures to stay alive.
I was popping the blisters and drinking the fluid to try to get something in my system.
60-year-old John Waddell recounted how he survived for the first time on Sunday.
We got a man that fell down a shaft that's approximately 100 feet deep, and his legs broke to beat hell.
Maricopa County deputies raced to rescue Waddell from the bottom of a mine shaft about 100 miles northwest of Phoenix.
All right, John, you're out. How you doing?
I didn't know anyone was coming for me. I thought I was going to die.
The 20-year mining veteran rappelled 50 feet down the shaft looking for gold when his rigging broke. He plummeted another 50 feet where he screamed for help.
I started hallucinating. And I'm laying back, and it's like a black cloud that's real stringy. And these figures were coming out of this like a little cloud. It almost looked like animals.
As the hours passed, it was real rattlesnakes that slithered around him.
I don't like killing them, but, you know, it was either me or them.
The sound of snakes turned into the sound of a diesel truck and an old friend offering the first glimmer of hope.
I started hearing someone hollering back, and I broke down and started crying because I knew that, you know, I'm going to get out of here. At the point you give up, you don't know what else to do. And I was just so thankful. It was quite a ride.
Keep going. Up orange.
15 volunteers from the Maricopa County Sheriff's Mountain Rescue Posse worked for almost 3 hours to get him out.
He was very calm. We check on his vital signs every 5 minutes, so we're constantly interacting with him.
Banner University Medical Center Dr. Cliff Jones says Waddell is already healing well.
He's a very strong person, and I think that's probably going to help out as much as anything else.
It'll take at least 6 weeks before Waddell is able to walk again. The setback won't stop him from heading back to the mine for the gold he found before falling.
This time with someone there and a little better equipment, I just might. Yeah, that's what I've been doing for 20 years, and it gets in your blood.
John Waddell just had a second surgery last Friday, and there's no word on when he'll be released from the hospital. Even though he wants to go back for the gold, he hasn't ruled out selling the property and finding something a little easier to do. In the broadcast center, Bryce Newberry, Cronkite News. In Maricopa County, there are hundreds of homeless veterans who have dealt with issues ranging from incarceration to drug addiction. Now, one organization is working to improve these veterans' lives. Reporter Matt Lively went to Flagstaff to see the power of healing through bonding.
This campground in Flagstaff may not look like much of a battlefield, but it is filled with soldiers. Veterans who have fought for their country's freedom and their own.
Chose to self-medicate as a way to deal with life.
The excuses because of the pain meds that, just sank in that it was all just lies.
Ray Perez and Robbie Vieira aren't alone in the difficulties they endured after their time in the service. In fact, the Maricopa Regional Continuum of Care Board reports that there are over 400 homeless vets at any point in time in Maricopa County.
Every veteran's path through life is a little bit different. Some are tougher than others. Every day in America, 22 veterans take their lives. That's a statistic that Ray Perez and Robbie Vieira were hoping they wouldn't become.
Multiple attempts of suicide, taking my own life. I didn't want to live anymore. In and out of the jailing system, yes, I am a convicted felon. And my last violation was spent in solitary confinement. And that's when I threw in the towel. That's when I was ready for change.
Perez now works at the VA and is involved in the Veterans Court, a system aimed at helping vets in legal binds to become contributing members of society. This is why Perez co-founded Operation Restoring Veteran Hope, an organization dedicated to helping vets bond.
6th of June, 1944.
And that's why the vets are here, huddled around a fire in a northern Arizona forest, listening and being heard.
His name was Dominic Tripodi. He was an Army veteran.
Oh, glad to be with you. I'm here to share about World War II.
Part of Perez's goal with this organization is to have retreats like this one. Outside of Phoenix and engulfed in nature, the vets are able to kick back, adventuring, raising the adrenaline levels, and some friendly competition are just some of the therapeutic activities they're participating in.
It's been very emotional. I've had veterans throughout this weekend come up to me, thanking me for putting this together. It's an awe moment for me, and I'm just enjoying being around my fellow comrades.
Comrades like Robbie Vieira, who's still trying to find his way down the right path.
All right, so what branch did you serve in?
I served in the Navy. Yeah.
What years?
73 to 75, 12 years of jail and prison, and homeless. It's been a long, disappointing life as far as my criminal situation. But I've known, a lot of real good life. I'm older now, so it wasn't all bad.
With help from fellow veterans like Perez, Vieira has found temporary housing and is participating in programs like the Veterans Retreat. And this outdoors getaway is serving him well.
It's been a big, what I'd say, a breath of fresh air, like a breath of new life. It's been so relaxing and so peaceful that I could actually feel the serenity and the beauty of life again.
There can be a lot of noise in the battles of everyday life, but all that could be heard at St. Joseph's that weekend was support.
Post-military, we deal with life, ups and downs and all around. And we get kicked down, we beat ourselves up, and sometimes we feel less than and we feel hopeless. And the goal for all this is to be hopeful rather than hopeless, to know that there's light at the end of the tunnel.
In Flagstaff, Matt Lively, Cronkite News.
More than 40 veterans attended the retreat, and many of them went through the Veterans Court after their arrests. The hope with an organization such as Operation Restoring Veteran Hope is to keep them out of the courts and in the community.
A new medical school is being built right in the heart of Phoenix. Reporter Cami Clark shows how Creighton University could give Park Central Mall a new lifeline.
Park Central Mall is getting a facelift here in Phoenix, and the plans include bringing a Nebraska university to the city's oldest shopping mall.
That campus will include a medical school, nursing school, pharmacy, occupational therapy, physical therapy, physician assistant training, and emergency medical services training.
The school will fit into a new vision of Park Central Mall, with new stores and restaurants nearby St. Joseph's Hospital and Medical Center.
Everything that we're doing here at Park Central, particularly on the exterior spaces, will be a major attraction to not only the students at Creighton, but to the people who come to Park Central to work.
As Park Central Mall is changing with the times, Creighton University looks to it as a hub for students.
We also wanted to make sure as a university is that we like all of those amenities for students, but we really don't necessarily want to provide them ourselves. We want to work with partners like Park Central, where there is a Starbucks, a First Watch, a Jimmy John's.
The new Creighton University Health Sciences campus is expected to be completed by 2021. In Midtown Phoenix, Cami Clark, Cronkite News.
Park Central Mall's construction of expanding a new parking garage and revamping its storefront is estimated to be finished by next year.
Concussion research is at the forefront of football safety concerns. However, there is one injury as relevant as ever and seasons right on the spot. Reporter Anthony Totri found out what athletes can do to combat that injury.
I caught the ball, turned upfield, and my foot got stuck in, and I tried to plant while my foot was still stuck in the floor, and it just snapped.
Carter Wheat is one of many.
I knew right then and there.
A torn ACL ended Wheat's sophomore football season at Red Mountain. Now a senior, he says his knee is as strong as ever thanks to his high school's emphasis on keeping athletes healthy.
And after a hard battle on Friday nights, I'm telling you, we need to have all the injury prevention and stretching and to help us out ready to go for Monday.
Red Mountain High School is one high school taking ACL prevention to the next level, and they're doing so with a higher frequency of single leg lifts like this one. Red Mountain's weightlifting program utilizes a variety of dynamic lifts that replicate in-game action, whereas static lifts, which increase muscular strength and endurance, don't incorporate much movement.
So an ACL injury most often happens when an athlete plants the foot on the ground so the foot's fixed, and then there's a rotational force, with or without trauma.
Brophy High School athletic trainer Chris White said the program has had multiple players tear their ACL this season, which backs up a 2013 study conducted by the Journal of Athletic Training that found boys were 4 times more likely to tear their ACL playing football than any other sport. The study also concluded that 71.2% of all boys' ACL tears recorded in the sample were due to football.
If you're playing high school and club at the same time, doing the same movements over and over again, there's a heightened risk of especially chronic overuse injuries. And the body breaks down, and that could potentially put you at higher risk of ACL injuries.
There may not be one way to guarantee an ACL injury doesn't occur, but White and Brando said stretching, lifting in a purposeful way, and understanding limits can boost an athlete's chances of staying on the field. In Phoenix, Anthony Totri, Cronkite News.
Knee injuries are the second most common injuries among high school football players, according to a 2016-17 study conducted by the Center for Injury Research and Policy.
Boating team, all connected by more than just their sport. Cronkite News reporter Ethan Gaines went out to the water to follow the team as they prepare for their next big race.
10,
The Phoenix Desert Dragons are a unique group in an even more unique sport. They are an all-female group of breast cancer survivors who compete in dragon boating, a sport similar to kayaking, but with a larger boat. Dragon boating has been popular among breast cancer survivors since 1998, when Canadian Dr. Don McKenzie published a paper on the physical benefits of dragon boating as both a cardio and an upper body workout, specifically for breast cancer survivors, like Desert Dragons coach Melissa Adams.
Physically, we know that it decreases the chance of lymphedema. Dr. McKenzie from Canada had done a research study that showed that doing dragon boating will help women that have lymphedema. And that is very common for breast cancer survivors when they've had lymph nodes removed as a result of part of their treatment.
Melissa said that dragon boating doesn't just help the women with their physical health, but their mental health as well.
We think of dragon boating as being an on-the-water support group. There's just a lot of power in being able to surround yourself with these women who have experienced something so horrific in their lives. It's really just a place for them to belong without having to talk about breast cancer.
Laura Rasmussen has been with the Desert Dragons for several years now and has experienced a lot of success with the team, despite entering the sport without much athletic experience.
Winning medals at my age is an amazing experience. Everything about the competition, the racing, the practices, it's all about the team. It's not about me.
In October, the Desert Dragons will compete at the Rose Regatta Festival in Las Vegas. In Tempe, Ethan Gaines, Cronkite News.
That's it for Cronkite News tonight. Thanks for joining us. For top Arizona stories anytime, go to cronkitenews.azpbs.org.